So.
I love free bleeding. That's my go-to. I'm a free bleeder.
I love that.
For real. I'll put on some like black boxers, go to bed, and I'm just like, I don't care.
Welcome to Pelvic POV with your hosts and doctors of physical therapy, Amanda Neary and Hannah Meyer. What's up, pelvic freaks? Welcome back to another episode of Pelvic POV,
where you're freaks for us and we're freaks for your pelvis, baby.
It's wild that it's August, right?
It is.
Like July was just a blip in time, and now we're almost approaching the end of summer. I'm not happy about that part.
Yeah, July was giving blip.
It's giving blip. But it has been so freaking hot the past few weeks in Chicago that part of me is ready for a little cozy fall season.
Yes.
I'm not quite there yet. How's your brat summer going?
It's going ultra bratty. I'm about to make an Instagram post about being a brat.
I love that. Am I in it?
Probably. I'm going to include Lala stuff in it.
Okay, cool.
Yeah, I'll do a dump. I'll do a little dumpy.
Gotta do a little dumpy dump. Today we want to talk about all things period because as pelvic floor PTs, we get patients in our office asking about them. Patients with periods come into our office and they're like, what is the deal here with my period? And we just want to clarify some things, talk about the cycle. Then we have this whole issue about tampon toxicity that came up recently. And we just want to touch on that a little bit too.
Yes, 100%. So we're talking all things periods today.
Periods. And if you're someone who uses a method of birth control that prevents you from having an actual period, this information can still apply to you because you're going to maybe experience some symptoms. I've seen plenty of people with IUDs that are like, I don't actually get a period, but I do feel a little different around the time that I might have gotten my period if I were to bleed. So this information may still apply to you. And if you're someone that is considering going off of that birth control at some point, like this is some information you could take in as well. So we don't want to exclude you guys. We know that not everyone bleeds. And on certain IUDs, you may or may not still ovulate. I learned that recently. So as pelvic floor therapists, I don't know if you feel this way too, Hannah, but I feel like people ask all the time. One question we get asked is, can I come on my period to pelvic floor PT? And it's actually on our frequently asked questions on the website because yes, you can. It's not contraindicated to do internal treatment, but it can be really beneficial to come during your period. It can actually help with symptoms because sometimes pelvic floor related tension and pain is worse when people are on their cycle. And this is specifically prevalent in cases where a patient might have endometriosis or painful intimacy issues or sacroiliac joint pain. They might come in and say, my period's about to start and my pain is acting up. And some people are like, should I still come? And I'm like, absolutely yes, because we can make a big difference during the cycle too. We can work externally on muscles. If you don't want to do internal, we can still do internal treatment. It's not contraindicated at all. It's nothing we haven't seen before. So these are just a few ways that we like touch on treating patients while they're menstruating.
Yes. And I've actually recently, some of my patients that have endometriosis, I've been having them come in right before their period too, because we can do internal work and do our session and it can kind of prep them for their period. I always tell people to track their period. I use the app Stardust. Because, have you heard of it?
No.
Okay, my friend MK, shout out MK, told me to get it because it not only tracks your period, but it tracks your period with the moon cycle too.
I love that.
So you can see how your period aligns with the moon cycle. That's why I'm always telling you, I'm like, oh my God, it's a full moon. I'm getting my period.
Yeah.
It's kind of a witchy app. It's really fun.
I love that. That's cool.
Yeah, this is why I love the Stardust app, guys. This is what it says for me today. I'm on day 18 out of 30 in my cycle. It says progesterone may cause you to dream of warm cookies and mountains of ice cream. It's the cravinest time of the month. Bon appetit.
I want it right now. Definitely download it.
So cute.
So
and then you can track like your mood and like your symptoms, pain, etc. It's kind of fun.
I use my Oura ring to track my period.
Oh yeah. I know.
It links with natural cycles, so it just is like it.
That's more accurate because it checks your temperature.
Yeah, it checks your temp. It'll literally, I'll wake up the day my period starts and my ring is like, did you start bleeding yet? And I'm like, this is so spooky that you know.
It is spooky.
It's smart. It's a smart little device. I like that. I'm going to download that too though, because I always talk about the moon affecting periods. Like if you're not on any contraception and you like are in tune with the phases of the moon, like you look at the moon every night, you'll eventually sync up with it.
Because the moon cycle is the same length as the menstrual cycle. Oh my God, it would be so cool to have someone like an astrologer on the pod to talk about that, like the link between, because I don't know enough to go into full detail, but I would love to like yap about that.
Yeah, I love that. So seeing patients on their periods or around their periods, and how does the period affect pelvic floor symptoms? So this is getting a little bit into the different phases of the menstrual cycle, where each phase has a different hormonal balance in the body, right? And different things that are building up to start your bleed, after the bleed, what's happening. And my biggest takeaway on how it can affect the body is, this was actually my graduate school dissertation. I talked about my like background research for my study was about cycle syncing with like professional athletes and how it can affect the likelihood of injury and ligament laxity during menstruation. So in the general population, there weren't many factors increased in terms of like likelihood to have an injury during menstruation, but there is a known increase in the hormone relaxin, which will create more laxity in the ligaments during your cycle. So just using our common sense of what we know about that, knowing that there's more laxity in these tissues, if you have an imbalance in the muscles of the pelvic floor or around the pelvic floor or any ligament laxity in the pelvic girdle, it makes sense that during your cycle you might have a little bit of an increase in that imbalance or a spike in painful symptoms or something that might be associated with that, which I find really interesting. So I will get patients in all the time that are like, something happens during my period every time it comes and I don't exactly know what. And I'm like, well, it makes sense. Your body's technically a little different on your cycle.
Yeah. That's cool. We should link your research article.
Yeah, we can link it.
We should link it.
Okay.
So that people can read it.
I'll link it.
A little subtle.
So sidebar, my research is actually a qualitative study on how female identifying patients prefer to be treated as women.
Oh.
So it was the background research was about like period studies and what clinicians knew about periods.
Okay.
And then the research we actually conducted was interviewing previous physical therapy patients and seeing how they felt their clinician treated them and if they felt that their cycle was considered, if that was something that they would have liked to have considered. Mm-hmm. So that's kind of what the research was, but I can still link it.
I think you should still link it. It is, I want to look into it too.
Yeah. I see so many people that are approaching 30 that are like, I always thought people were lying about the low back pain on your period symptom. And then I turned 28 and there it was.
It's hidden.
It's hidden. There it was. But yeah, and that just goes to show in pelvic floor PT, we're treating a lot of the accessory muscles as well. We can treat internally. We can treat into the low back, the abdominal wall. I know we touched on endometriosis, but if you don't know what that is, we're going to do a full episode on it. It's a big topic. It's when you have fibrous tissue growing outside the uterine wall, and it can actually eventually wrap around the fallopian tubes. It can grow down into the pelvic girdle, and it can cause a lot of discomfort, and periods exacerbate those symptoms. So we see a lot of endo patients, like Hannah said, before their cycle and on their cycle to help reduce some of that pain. And that is a big part of what we do.
It is heavily correlated to your cycle.
Mm-hmm.
And what I've seen with my patients, which is why I'm saying track your period. Let's get this. Let's see. I like to have people track their period so that we can see trends and know what to expect.
Yeah.
So then you're just like what we've said before, learning more about your anatomy and your body.
Mm-hmm. And just like anything else that we ask, it's giving us baseline information. Like, how is this related to something you experience on a monthly basis?
Yeah. So we talked a little bit about the menstrual cycle. So what are the phases of the menstrual cycle?
Your menstrual cycle starts with your period phase, your menstruation. And that is when you are actively bleeding. You're going to have hormones that increase the thickening of the uterine lining, and that lining is going to shed. So what you're actually shedding is the lining of your uterus, and that will pass through the cervix and out the vagina. And then we
lovely
to
our favorite time. That's our favorite time of the month.
Sometimes I do actually feel like Superman on my period. I'm like, oh, I could like flip a truck right now.
Actually, yeah.
After I start my bleed, not day one, never day one.
I can always like feel I can feel when I'm about to start. Like I won't even actively be bleeding and I'll just be like, yeah, I'm getting my period in probably an hour.
Yeah.
It's crazy.
Probably an hour. I love that. And then, so the average cycle length is 28 days, but I think it ranges anywhere from like 20 to 35 days within that normal range. And after you bleed, you have your follicular phase, which lasts from the end of your period to your ovulation.
And this is the longest phase of your menstrual cycle.
It's the longest phase because everyone ovulates at a slightly different time. It's the body tells you when you ovulate. And you're going to have hormones that increase the thickening of that uterine lining again. And also you'll have follicle stimulating hormone, which is going to prepare the ovaries to release an egg that could be fertilized.
Un bébé.
I was like, what word am I looking for?
Un bébé.
Fertilized. Un bébé. Un bébé. Ovulation is the third phase.
Mm-hmm.
The hormone they're going to have an increase in is luteinizing hormone, which will help to release that egg from the ovary and allow it to be fertilized.
Love that.
And after ovulation, you have your luteal phase, which is when you could actually become pregnant if an egg is fertilized. And depending on whether or not you are pregnant, your hormone levels will change in preparation for menstruation or for pregnancy. So that's just a general overview. We definitely want to get someone on here who like specializes in the menstrual phases from a medicine side of things, because I think that'd be super interesting.
I always see people on like Instagram and TikTok that are promoting or making content on like how important it is to know about your cycle.
Yeah.
And I really want to get in tune with that.
Yeah. Yeah, we should get more into that. But it is interesting to know at least the phases and just the general shift in hormones.
Let's get into period products.
Period products and the drama.
The drama.
If you guys haven't heard, recent studies found toxic levels of lead in tampons.
It was toxic metals in general. It was like a bunch of different metals, and it was a study done by UC Berkeley. But there's a lot of drama around it. I think there's some like fear mongering going around. Like everyone's just like seeing the headline of the study and then like freaking out and being like, oh my God, like lead and metals and stuff in tampons. But I feel like it was just kind of presented to us like that. And we haven't really like not a lot of people have looked into the study.
Mm-hmm. The study itself does not say what brands were tested either, which I don't know why, if that was from like a political standpoint, not wanting to piss people off, but to make that claim and then not tell us which products to avoid feels very irresponsible to me.
Yeah. And I've been looking up what other people have been saying about this, like physicians and et cetera. And I guess like the study is a little controversial because they didn't actually study how the metals impact the body or how it gets absorbed through the vagina. They just like studied like what is in the tampon. And I guess there are levels of metals in a lot of things that we use regularly that we don't know about. And it's kind of an interesting study. Maybe we can go ahead and link it if you guys do want to read more about it. But I feel like pretty much everyone in the world just doesn't really know what to think about it yet, because it's bringing up this discussion on how women's health has not been prioritized. And everyone's like, why the hell are we just now figuring out that there's metals in tampons? Like, is this really the first time people are testing tampons? And we've been using tampons for centuries. And that's what everyone is getting really upset about. The results from the study are still kind of like, okay, should we avoid this? Is it still fine to be using metals? Or I think there just needs to be more. There needs to be more done.
Yeah.
And there are limitations to this study too. I'm going to read some of the limitations from the article. So they put in, we do acknowledge that our study has limitations. We did not have sufficient power to assess statistical differences by absorbency. So like how the vagina absorbs the metals. And they try to include as many brands as possible. But like we said before, they didn't mention the brands, and they didn't. There are some brands that they didn't include. Some of the conclusions that they drew from the study is that this is the first study to assess concentrations of metals in tampons, despite the potential for substantial vaginal absorption of metals and the widespread and frequent use of tampons among menstruators. So they just found that there's metals in the tampons, but they don't know exactly how that impacts people with vaginas. Okay. Then another important thing that they mention is future research is necessary to replicate our findings and determine whether metals can leach out of tampons and cross the vaginal epithelium into systemic circulation. So that's like a big point, is that we just don't know yet exactly how that impacts us. And we're not saying to like completely stop using tampons just because there are limitations to this study and we don't know exactly what it does to our bodies yet. But if it is bringing up that fear in you and you're like, oh my God, tampons are just now being studied. I've been using these my whole life. Is it contributing to the pain that I'm experiencing on my period? Who knows? Like there hasn't been any research done on that. But if it is like bringing up that fear in you, there are different products that you can use, which we can discuss.
I personally have not used a tampon in 10 years.
I still do use tampons, but I'm thinking about making the switch personally just because of the study. And I'm just like, there is better things to use. And I hate the fucking pee string.
The pee string is the worst.
I hate the tampon pee string. If you know, you know.
I will give a shout out to my friends in LA that when we were in college and the Diva cup became a thing, they immediately convinced me to like make the switch.
Most people use Diva cups now or flex discs. A lot of people use cups. I made a post on my Instagram story and I was like, send in what period products you are using, just because if people are kind of like, oh my God, tampons right now, I want to be able to share. And everyone said the salt reusable disc, like almost like 80% of people said the salt reusable disc, Diva cups in general, menstrual cups, salt, perfect. That's kind of the main response that I received. Yeah. And then the flex disc too.
Yeah. Tampons are fine. We keep tampons in the clinic.
Yeah.
I always pack a couple for an emergency.
Yeah, it's good to have just in case. Some brands that I use, I like the Cora brand of tampons. I've used those for a long time now and I've never had issues. You can get tampons without the plastic applicator too. Saves the environment. The first time I used a tampon, I remember the first time I got my period, I was on a cruise ship with my mom and my sisters and everyone. And I got my period and I was in a bikini and my mom was like, well, you got your period, so let's put a tampon in. And then I was just like, remember being in the tiny cruise bathroom and I was crying and I was like, I don't want to put in a tampon. And I was freaking out and I was traumatized.
The first time I tried putting one in too, it was not successful. And I was like, what the actual F is happening?
My mom literally had to help me put my tampon in. I was like, I'm not doing this. It's disgusting. I remember like my friends in middle school, I remember like my friend got her period for the first time and we were all like teaching her how to put a tampon in.
Yeah.
Oh, womanhood.
Oh, so
love
cute.
that. That was actually a cute moment.
On the note of period products though, I do want to talk about something pelvic floor related because I have had people ask me if using a cup increases your likelihood of prolapse. And I think that's something we can address right here and now. The answer is no, but you do need to release the cup properly. So I think people are picturing like, if I'm just yanking this thing out, is that going to increase my likelihood of prolapse because it's pulling on those muscles a little bit? From experience and seeing a lot of pelvic floors, I think that amount of pressure would not be enough to make a actual difference in what is happening to the vaginal wall.
Yeah, however, it would be more like if you're pushing, straining down, generating internal pressure, that's going to lead to more prolapse symptoms rather than like suction it.
But if you're straining at all to try to like push this cup out, that's when you're going to get that weakening in the vaginal wall. You know, your body's very resilient and adaptable, and that amount of pressure should not affect those structures. Just keeping all of that in mind, you want to release it properly. You don't want to be straining to push these products out, and just using them as instructed is going to help prevent that.
I think that you nailed that in the
headboard.
What is the phrase? You nailed it.
The nail in the coffin.
You nailed the coffin shut. You nailed the coffin shut with that one. No zombies getting out today.
I don't even know if that's right.
Put the nail in the coffin, baby.
The nail in the headboard was so good.
You just nailed it.
You nailed it.
Anyways, another question we got. Should I stop using tampons now because of the study where metals were found in tampons? And we kind of answered this already. Use your best judgment. I still will be using tampons occasionally. I'm not going to like let it be like, oh, I can't ever put a tampon in my body yet. I'm going to wait for like more research to come out before I like completely I'm going to stop using tampons. But I am considering other options. Like I'm probably going to switch over to the cup personally because I also think it's just in general easier than having to switch out your tampon all the time.
I will say as a longtime cup user, it's so stress-free. I also am someone who always feared that I would forget to leave a tampon Or I would forget a tampon inside me, and then I would get toxic shock syndrome. This
Yeah.
was like a major fear of mine for 5 years straight. And that's part of why switching to the cup was a no-brainer, because I'm like, I always forget to pull that thing out.
Yeah.
How do I know if I have 2 in there? I don't know.
Yeah.
So the cup is nice, and I can keep it in for 12 hours overnight. Doesn't leak very much. If it does, I use like the period underwear with it too on like a heavier days.
Mm-hmm.
So-
I love free bleeding. That's my go-to. I'm a free bleeder.
I love that.
For real. I'll put on some like black boxers, go to bed, and I'm just like, I don't care.
Yeah.
This is the life.
Overnight.
I hate wearing
Yeah.
tampons. God.
I'm with you.
Mm-hmm.
That's our take on periods.
Yep.
We want to hear from you about periods and what questions you have about pelvic floor therapy around periods.
Mm-hmm.
You know?
Yep. Send them in, baby. So if anyone is interested in reading the actual research article, because it actually took me some searching to find the actual article, I just found like a bunch of headlines that are just like, metals and tampons, and like nothing really about the specific research.
Mm-hmm.
So if you want to read the actual article, it's called Tampons as a Source of Exposure to Metal, in parentheses, loids. And it was conducted by UC Berkeley. And we will link it in our episode description.
Yeah.
If you just want to be more educated on that.
Like they said, this was the first study on this.
Mhm.
So if you think about the highest level of research would be a systematic review, which is going to look at every study done on a topic. And that has to be high quality research. And then you're taking those studies and doing a meta-analysis of all their conclusions
Mhm.
to find what the actual consensus is among all these high level studies. So we're just looking at one study that has a fair amount of limitations in it
Mhm.
here. But Hannah and I talked about options if you are a little fearful based on this study, which you have the absolute right to be. And you have options for period products. And hopefully we get more research soon that's actually looking into vaginal absorption so we can make some better conclusions about it.
Period.
Period. Wait!
Good job.
So good. That was
Well, I think that includes our episode about periods.
about periods. Yeah, send us a period story or a period question if you have one about pelvic floor PT. And make sure you're following us on social media at Pelvic POV.
And follow our personal accounts at Hannah Meyer, Meyyerr,
And Amanda Neary, PT, and is in November.
and is in know the phases of your cycle. Even though it starts with a K, you guys get the point.
K is silent, so it works. Peace out, pelvic freaks.
Bye.